Do you like chocolate cake?
I do, and I ordered that almost every night at the hospital.
All right. Did Kathy Beatty know that you liked chocolate cake?
Yes. Yep.
Was there an incident where that was held out as a prize or something?
Yeah, so in PT, as my stay went on, they wanted me to improve, but because of their system of doing it, it hurt my CRPS, so I wasn't making the improvements that were typical of other patients that are non-CRPSers. So she thought that bribing me would maybe spark some more motivation for me to start doing different things. On one instance, she said that she would bake me a chocolate cake if I did well in PT. So I tried my best and I overexerted myself because the thought of just having something that was non-hospital food for the first time was enough motivation for me to, risk putting myself in more pain. So after the therapy session, I asked her if I could have it, and she said no, because it's Lent. Now, I have to explain this as well. So I'm Catholic, and Lent is a standard practice before Easter. You give up something for 40 days. And I'm a kid, so I don't really understand the time of when it was supposed to happen. I just knew that Lent was a thing associated with the Catholic religion, and I've done it before. I was in the hospital October, November, December, early January. That's not around Easter. She knew that I was Catholic and that I was so religious that she held the idea of Lent over my head and saying that I couldn't have the chocolate because I gave up chocolate for Lent.
So, what about talking to your mom and dad through this period? Now, was this a frequent thing or an infrequent thing?
Your Honor, I apologize for objecting again, but again, foundation and time frame.
Let's keep it around the time, but otherwise overruled.
Yes, sir. Yeah, I got them. Okay, thanks. So, let's talk about the graduation of...
I'm sorry to cut you off, but there's another story about Kathy and the PT, another bribe, if I could share.
Sure, absolutely.
Okay.
What happened with... I have to answer the question.
Okay.
What else happened with Ms. Beatty insofar as tempting you to do something?
Again, it was another religious motivation. She told me again, if I try really hard in PT, she will take me to the chapel. Not the chapel in the hospital, but the chapel outside of the hospital, a couple blocks down. So again, I tried my best, and after the PT session, I asked her, when can we go to the church? And she said, I didn't do well enough.
All right. I want to talk about in October, how often you were able to talk to your mom or dad?
Well, the visits with my dad and my brother, they varied. There was times where I was allowed to have visits with them, and then other times not. And then with my mom, I was allowed phone calls at certain points, and then again not. It was so on and off, I really have no idea of when it was permitted and when it wasn't.
And when you did have the opportunity to speak with your mom, were there any problems with those calls that made it difficult for you to communicate, or your mom to communicate?
There was always a problem.
Like what?
Well, it was always the person who was overseeing the calls, Kathy Beatty, again. She would sit on the edge of my bed, listen in on all the phone calls, and she would limit our conversation to very basic and insignificant things.
So I'm going to publish then 3 clips in evidence. For the record, they're 2608A, B, and C. And you've heard these previously?
Yes.
Is this, best of your knowledge and understanding, Kathy Beatty's voice that we'll hear coming in?
Yes.
If we play A, please.
Okay, I'm recording this phone call so everybody knows.
Okay, hi, Mommy.
Hi, honey. How are you, sweetie pie?
I'm hurting. I miss you.
I miss you so much too. I miss you so much every day. Every single day.
You know how happy it makes me feel to hear your voice.
Same here. I miss you so much, and I am so happy that I'm finally able to hear your voice too. Yeah.
I hope
How?
I see you.
What did you say, sweetie?
I hope I can see you soon.
I would love to see you soon. I would love to see you soon. We just have to wait for the judge to make the decision, okay? As soon as he makes the decision, then I'll be able to see you. Okay? Yes.
Beata, we're not allowed to talk about the case, okay? Maya, honey, we're going to talk about what you've been doing, if you need any Shopkins or things like that, if you had nice visits with your daddy, but we can't discuss the case, okay, honey?
Was Beatty the only one that would know about those Shopkins?
Yes,
All right.
because she is actually the one who delivered some of them to me.
When these were going on, what was Kathy Beatty's facial gestures?
So you can't obviously see it on the audio recording, but when I tell you, like every single time I had a conversation with my mom, she'd be rolling her eyes like that, or she'd be making faces or sticking out her tongue, like she was acting like a toddler.
Let's play B, 2608B.
How you doing? How is PT and OT going for you?
Not good.
Why is it?
Okay, Beata, we can't discuss any of those type of matters, okay?
Okay.
All right, and then 2608C.
And what do you usually need help with?
My pants.
What happens with the pants?
I just can't lift them up.
You can't pull up the pants anymore?
No.
But when did that start, Maya?
Oh, I don't know. A while ago. I don't know. Yeah. I don't remember when it started.
Okay.
TBH.
What's PBH?
Yeah, I know Reed, I left that line of conversation out, thank you.
Okay.
Now, during this period of time, are you aware now that your parents, strike it, are you aware now that through this entire period of time, your parents retained the rights to be able to be involved in direct your medical care?
Yes.
So we're trying to, discuss your physical therapy here?
I was trying to tell her about it because she asked, but Kathy Beatty put a stop to that.
All right, now, so tell us about the pulling up the pants, and it was good humming. I like the humming part, but why is it important that at this point you could no longer pull up your pants?
So it's showing how my condition, the longer I stay in, the more of the things I was able to do, I'm losing in terms of like my independence.
Right. Okay, and again, were you allowed to use any words of Polish in these conversations?
No, that's why I wasn't.
All right. I want to ask you now, did your mom and dad still try to get stuff for you during this period of time? You know, gifts, little things to cheer you up?
Yes. Yeah.
Did there come a time that they bought you a dress you always wanted, a more formal dress?
Yeah, so this was John Hopkins All Children's Hospital. We were at the Ellington outlet malls, and we went into Tommy Hilfiger, and there was this really nice dress that I was obsessed with. It's just white, the shoulder, it wasn't long sleeve, it was just the width of a dollar bill, And then around it was navy trim, and then the signature logo was on the breast area.
And so were there attempts made to bring this dress to you while you were at the hospital?
Yes, so my dad was permitted visitation, but everything that well, to my knowledge, like most of the things he gave to me, they had to go through certain people. And the dress that he had brought, it had to be given to Kathy Beatty before it reached me.
Did the dress ever reach you?
No, and I clarified with my dad because I thought, maybe he didn't know what dress I was talking about, but he was there when I bought it, and I described it to him. He knew exactly what I was talking about. Instead, I got a red dress, but to this day, that dress is probably rotting in Kathy Beatty's office.
Where did it turn out that dress that was not delivered to you, the Hilfinger dress, actually was?
Kathy Beatty had it.
No.
Oh, and I know that because another social worker said she saw it in Kathy Beatty's office.
That's right.
Yeah.
Okay. And so now I want to talk a bit about the day you were supposed to go to a court here, January 6th. Right? So on that day, were you excited?
I was ecstatic. I mean, not only was I getting out of the hospital for a little bit of time, I was going to see my uncle, and the goal was to see the judge.
All right. And were you preparing for it, trying to get yourself ready? And
Yeah, I told people in the hospital, the people, like the nurses and whatnot, I'm going to court today, I was excited, yeah.
And so then what happened insofar as trying, what did you have to do before you were allowed to go to the court and see the judge? What happened with Miss Beatty?
So it was my understanding that I was just allowed to go to court because they ruled on it and I was allowed to come in person. So I was just expecting my uncle was going to come pick me up, and Kathy Beatty was going to wheel me down to meet with my uncle and put me in his car. Instead, Kathy Beatty showed up in my room a little bit earlier than the time I was supposed to go. She came in alone initially, and she told me that if I wanted to go and see my mom in court, I was going to have to be stripped naked and photographed by her nude, so I could go to court. I cried and cried because I'm a very modest and private person when it comes to stuff like that. I have been, and there's a reason for that. I really respect my privacy, and eventually I was able to reason with Kathy, and she said that I could keep my training bra on and my shorts. That's when she left the room. She came back with Nurse Alicia, I don't know her last name, but she came in and she assisted with holding me down and moving me and removing some articles of my clothing for the photos. Now, the purpose for these photos, typically, DCF takes them. DCF did not take these. And there's supposed to be a side-by-side comparison of pre-visit and post-visit. So I was leaving the hospital, so they took the photos before. There was never photos taken after.
And has it come to your attention that this did not end up in any analysis in the medical records or anything like that?
That's another thing I was promised in the whole reasoning with Kathy about not being nude. She told me that I could keep my shorts on in the training bra, and I specifically asked her to keep these photos private. I asked her if they were just going to be in the medical record, and she told me, yes, only doctors can see them. She actually physically went over to the computer where I've seen nurses and doctors put in information, and turns out she never put the photos in there.
All right, so let's turn to, first I'm going to publish a photo, 2604. And were you actively trying to keep them from taking off your clothes? No, that's not it. There.
Yes, so that, you see my hands right there, and then Nurse well, someone else's hand. I can't tell if that's Kathy's or the nurse's, but I was trying to pull up my shirt actively as she was pulling it down.
All right. And around this time, where we go into a few more photos, did you document this in your MyCare journal?
I believe I did. I haven't seen the MyCare journal in quite some time, so I would need my memory refreshed.
Let's look at this photo here. Now, it has been portrayed that you were somehow enjoying this and just holding hands. Tell the jury what was going on.
I was not enjoying this at all. It is true, when the nurse came back into the room, I wasn't crying as much because Kathy had calmed me down after we made that, agreement. We met in the middle. But you can see my cheeks are red, and that happens a lot when I've been crying.
Okay, and we can see a little corner of your mouth there. Are you smiling, grimacing, or what?
I am most definitely not smiling.
Okay. And is that a training bra?
It is.
Now, was there a time that you had to switch out of one bra to another?
Yes, so they're trying to maintain the position that, I was in a training bra and shorts, like we didn't, see anything. No, Kathy watched as I got naked because I was changing into clothes for court. That's why there's two different outfits. But this was the same time period. There was no before and after photos.
All right. Let's look at 260415. There they are, blue shorts. Now tell us about the shorts. Did you remain in the same outfit during this ordeal?
No, because I was changing into court clothes.
Okay. So which are these, the blue shorts there? That's.
I don't know which outfit I ended up wearing to court, but.
Okay. And then let's look at 2, 3. Oh, no, we're going through these. Let's go through these. And now what is that? What kind of bra is that?
That's a training bra again.
Which came first, the training bra or the those are both training bras?
Both are training bras, correct? They switched them out.
So this wasn't a workout bra or anything? I don't know that
most
much
of
about
no.
bras. And did you tell them while were they holding you down through much of this?
Yes, and some of the photos you could see their hand, but it looks like the photos are mostly zoomed in, so you can't see their hand placement.
Did you want to leave and get out of there?
Yes.
And were they preventing you from getting out of there?
They were until the photos were completed.
And did you have any control or ability to get out of there? Physically?
No, because I couldn't walk or stand.
And this was against your will?
Correct.
All right, let's look at 2364, unless there's more of these we want to go through. Let's see. You down? That's it. So. Yeah, I got it. Okay. I wasn't going to cover it, but we will. So let's, what was your relationship with Alicia, the nurse that was in there before this?
So I had seen her before and I recognized her, and my first encounter with her, I trusted her. I had no reason to doubt her as, a healthcare professional. Actually here in the MyCare journal, I wrote her name. And the second time I saw her, she was assisting Kathy Beatty in photographing me and changing me in front of Kathy Beatty.
Let's look at 2364009. Is this it? All right, so she's right there. All right. And so how did you react when you saw that Alicia was now one of the people holding you down?
It was another complete breach of my trust.
Did you feel betrayed?
Absolutely. I felt betrayed in that hospital almost every day.
Now, I want to talk for a moment I think we've gone over the necklace that you still wear. How did you learn about your mom's suicide? And tell us the first time you felt that this may have happened.
Oh, yeah, that's an interesting story. So, on the 7th, I'll never forget, January 7th, I couldn't sleep. Again, it was a combination of just pain and, my depression from being isolated from my family. So I was up until 2 in the morning. And I swear to God, I am not making this up, at 2 in the morning, I broke out in tears. I was just crying uncontrollably. And I called the nurse in, and I told her, this was a nurse that I actually had a pretty good relationship with. And I told her, I miss my mom, I miss my mom. I love my mom, I want to go home to my mom. Turns out she ended her life.
Was that around that time that
Yeah.
you did? Okay.
That's why I always say that it was really January 8th that she died, not the 7th, because
You
I
felt
just have this feeling that it was then.
You felt it.
Mm-hmm.
All right. So, how did they go about telling you that your mom was gone?
So I had a visit with my Aunt Wendy, I want to say maybe the day after or so.
Uh-huh.
So this was the 8th now. And something was off with her. And I asked her what's wrong. And she said, I don't know, just something happened earlier today. Sorry. So she didn't end up telling me then. I just enjoyed the rest of my visit with her as usual. And I'm not sure if it was that evening that my dad came in with my brother and Father Jack, but I know it was sometime close to January 8th. And I was sat down on the couch. My dad was I think I was maybe I wasn't in a wheelchair, maybe I was on the couch. My dad may have lifted me and put me on the couch, so I'm not sure about that specific detail. But my dad was right next to me, and right next to my dad was Kyle. In front of me was Father Jack. My dad said he had some bad news. And weirdly enough, the first thing I thought of was they're not going to let me home, or that I was going to be put in foster care. And it turned out to be even worse than that. My mom had died. So I was told that, and immediately after my dad had to leave.
Okay. How long was your family allowed in there to tell you that your mom had passed?
It wasn't a lot of time, if I'm being completely honest. It was actually so unbelievably cruel, the amount of time they allocated for me to spend with my family after hearing such awful news.
So after this now, if your mom was supposed to be the reason why here with this Munchausen thing, and your mom's gone, did they let you go?
Objection. I'd like to approach on this one.
Members of the jury, I'm going to sustain the objection. I'm going to direct it to disregard the last question. Let me give you an instruction at this time. At the time of Beata Kowalski's death, Maya Kowalski was still under the jurisdiction of the dependency court, and a court order remained in effect continuing Maya Kowalski's stay at Johns Hopkins All Children's Hospital. And Johns Hopkins All Children's Hospital could not release Maya Kowalski without a court order. You may continue.
To the best of your knowledge, after this, did Johns Hopkins continue to maintain a diagnosis of Munchausen by proxy?
Objection, foundation.
Overruled.
Yes.
And are you aware of how they responded to your mother's suicide internally?
I am. I actually had one-on-one interactions with the nurses. So most of the nurses, when I told them, they would say, oh, sorry, and just kind of continue on. And here I am just like crying, no consoling me whatsoever. However, there was one nurse who did she was extremely kind and compassionate about the whole situation. As a matter of fact, she started crying as well.
So let's publish again 2175-004. I'll ask you whether anyone here at the hospital did either of these doctors ever tell you that they thought it was the right thing for you to lose your mother?
Object to the statement of emotion.
It's overruled.
They never directly one-on-one told me, but the fact that they kept me in the hospital and they regularly told me that, my mom was forcing this on me, they felt that their whole narrative that they were maintaining, they felt that it was better that I was without my mom.
And there on the bottom, did they believe that now life was going to be better for you without your mom in it?
Objection, speculation.
Overruled.
It's sickening, but yes.
And Maya, we'll get into it in a moment. Right. All right. Let's show 1002-001. Publish that. It's in evidence, Your Honor.
If it's in evidence, you may.
Okay. All right, I'll ask you now, I asked you a question before about Munchausen by proxy. If you will look down there at the bottom under the admission diagnosis and then the discharge diagnosis, what is it?
It's fictitious disorder, Stillman-Munchausen syndrome by proxy, and conversion disorder.
All right, now, how long was it before you were able to go home?
I was released on January 13th, and that's why 13 is my lucky number.
Okay, so about, 6 days after your mom?
Correct.
All right, let's show 2528-002 and ask you how things were when you came home. I don't think that's... I think it's 2528, 2 and 3. That is definitely not, and neither is that. I know, and they're not the right ones. This is the... Two 2580. 82. So it's super backwards. All right. So it's 2582002, 2582003. Tell the jury what's happening here.
So this is at the very entrance of my subdivision. I am in one of my dad's friends, but he also went to the same church as us. He helped pick up our stuff and take all our belongings out of the hospital, so I'm in his car. And it's basically the entire neighborhood with balloons welcoming me back home after 3 months.
Okay. And then
3.5 months.
And then let's look at 2582003. Okay.
Yeah, so this is another sign that was part of the homecoming party.
Now, in the car coming home, were you able to hold yourself up?
No.
Can you describe for the jury your condition
Well,
physically?
I was not doing well. I had lesions, discolorations, temperature changes. Now I physically wasn't able to sit up by myself. As I explained earlier, we had to basically start all over from the beginning. I couldn't even open up a bottle cap. I had to have help using the restroom. That included, even later on when I went to friends' houses, I had to have their parents help me, which is extremely humiliating, but it's how my condition was. I can no longer stand up like I did on the walker, like I did previous to entering Johns Hopkins. and my pain obviously was a lot worse.
So now, what did you decide to do in strike it? What was it like, although we'll get into damages another time, but what was it like coming home to the house after this?
It was very emotional. I remember being wheeled in and having to be pushed to my room because I couldn't wheel myself anymore. I remember, you know how like every house has like a smell? Like when you go into somebody else's house, it smells. It was just like so soothing to like have that familiar like air around me, I guess. I remember my room. It was very different than how I have left it. There was gifts that my dad had to take home from the hospital that I wasn't permitted to have in there. There was 2 notes my mom had written me.
That never made it to you?
No.
And how was it without your mom being there?
I mean, as much as I was happy to be home, I try not to complain, but obviously it wasn't as perfect as I wanted it to be. I wanted her there.
So now you had a decision to make on your recovery. What did you decide to do?
I decided to push forward.
And tell the jury how you did it, what you did.
I didn't consider my circumstances. I considered my God. I didn't consider what I didn't have. I considered the resources and tools I had. I had to shift my entire mindset. It was so hard, but I did it.
And you did it without use of any ketamine or any other meds?
I did.
And why not? What was your worry if you did?
I was scared that I was going to end up in the same situation I just got out of.
And so, in terms of going to see doctors and so forth during this period to help you, what was your feeling about that?
I didn't want to ever see a medical professional again. Not even my primary care physician that I've seen forever. He's such a lovely guy, and here I didn't ever want to step foot into his office. I didn't want to ever go to a doctor.
How about Agility Fitness? How did they fit into this?
So Agility Fitness, it's like a physical therapy center, and I don't know if he's like the manager or if he owned the place. I don't really know what his title was, but he went to our church. So I trusted him, and he has a really nice family. I've met them all. And that's when I worked with Rachel Young. I previously had some interactions with her, and I really liked her. Mm-hmm. So I worked with her very frequently.
And so how long then, this time, did it take you, how long did it take you to be able to start to transition from wheelchair to crutches?
So it was 6th grade when, so this was the fall, I would say August, middle August, I was able to get up on crutches, and I struggled very much so throughout the school day. I was quite miserable, but I got stronger and stronger every single day. I mean, I truly believe my mom up in heaven really helped with facilitating my recovery, but it was not pain-free. It most certainly was not. It was very hard.
Was it significantly harder than when you had the ketamine and the other meds to help you?
Oh, yes.
Mr. Anderson, within the next 5 minutes, let's find a breaking point.
Yes,
within
sir.
5 minutes.
Yes, sir. And then, I just have 2 questions. And then, how long did it take you until you were able to start getting off crutches, either to one crutch or completely off of them?
It took about another year. Yeah.
So almost, 1 year and 3/4, 2 years?
It was a little bit more than a year, but yeah, I did it.
Now, again, this was not.
Within 5 minutes, so just, you
Yes,
lead
sir.
us within 5 minutes.
All right. So now, after you had gotten out of the wheelchair and off crutches, did you have a relapse then within a year or so?
I did.
And when was that? The record reflects that
It was 2020,
November
but-
of 2020.
Yeah, I know it's 2020. I just forget what month.
All right. So tell the jury about how this came about. What was it that was triggering you or starting it? Did you injure yourself? Or what?
I didn't have a physical injury for this relapse. However, I was having lots of depots during this time, and the stress from litigation really impacted me.
No, we won't talk about that part of it.
But yeah,
all right. Were you still having a great deal of pain at this point?
Yes.
And did you have a stomach issue that came
Again, yes, I did.
And was this the same type of pain that we talked about before with the gut muscles?
Yes, in a similar way, yeah.
So explain what happened with this.
So I had the burning pain again. I was stressed out, so I wasn't eating so much, but the CRPS pain, once I had that relapse, it just amplified the entire situation. It hurt to eat, and I was falling apart.
Let's publish 2580-001. Okay. When did you dye your hair there, or what's that?
No, that's my natural color, actually. It's just the lighting in the room.
Okay.
Yeah.
All right. And was this during COVID with the mask, or was it just you were in the hospital?
It might have been COVID.
I can't remember when COVID was. All right. And so then let's publish 2580-002. Now,
I apologize, Mr. Anderson. Can you tell me what the date of this of the last order?
sure. This would have been, I don't know that's on there. It would have been in November of 2020.
Yeah, they're all the same time frame.
November 2020 or 2022?
2020.
2020. All right. So is this you?
Yes.
What's wrong with this picture? Had you lost weight?
Yes, a significant amount.
Is that your collarbone there?
Yes.
How much weight did you lose?
I don't know the number, but it was a substantial amount.
And did you have to have something done to eventually stop this wasting away?
Yeah, so there was a feeding tube placed, and I got sedation for that one. I asked for it, and they had no questions about that. And then my dad helped at home with the feeding treatment, and I only stayed in the hospital for 7 days. I don't know if that's but I know it was a week or less. And they were very understanding of my situation and took care of me.
Let's look at 2580-002. That's you again. And your legs are very thin there.
Yes.
Now, previous to this, had you had a port in for infusions?
I did, yes.
And who put that port in?
John Hopkins All Children's Hospital.
Where on your body was the port?
The port was on my right, under my armpit, kind of. I didn't want it on my chest, so it was placed under my armpit.
Was it for the purpose of ketamine infusions?
Yes, actually, we told the doctors at John Hopkins All Children's Hospital that the purpose of this was for ketamine infusions at Dr. Hannah's office, and they were agreeable to that.
So they performed an operation to help your ketamine infusions?
They did.
Did anyone question whether your mother was committing Munchausen by proxy by getting a port for you?
Objection, speculation.
Overruled.
No, they did not question it.
Well, did they question whether you had CRPS before they put a port in?
They accepted the diagnosis.
And how did those doctors treat you?
Those doctors that I encountered at Johns Hopkins, they didn't question my diagnosis, and they were ready to put the port in because they knew it was necessary for my infusions.
Okay. All right. So, again, you were inpatient here. Why?
Mr. Anderson, we really need to take a break.
Maya, there have been, strike it. Are you continuing to have relapses here and there?
Yes.
Can you tell the jury how and why they come about, if you know, and the length of them?
Right. So whether it's from a physical injury or if it's just intense stress or like mental, just like problems with stress or anxiety, it can impact the severity of my relapses.
And are you experiencing stresses in terms of going past hospitals, seeing people that look like people involved in this and so forth?
Yes.
And have you, since the time of being in Johns Hopkins or while you were there, become familiar with the fact that CRPS can be fatal?
Yes.
Does this have any effect on you?
It worries me because I am scared to seek the resources that once had helped me, in fear of going back to a situation similar to that of Johns Hopkins. And I've met people who have passed away from CRPS.
And Maya, have you tried different activities that you did before all of this happened, before you went into the Johns Hopkins Hospital this time?
Yeah, so there was one instance when I went with my best friend and her brother and also my brother. We went to Ellington, the ice rink, and we just skated around. That was when I was walking, and this was in middle school. But it wasn't until high school that I started to take lessons. I just wanted to try it out, and it's something my mom and I had done together, so I wanted to revisit it. It became too hard. My pain increased. I was falling, and I just didn't want to risk a relapse, so I quit.
And you miss your mom.
Yeah, it's hard.
We'll talk about that a little later. Your witness.
May it please the court. Good afternoon, Maya.
Hello.
Before we get started, I want to tell you that I'm very sorry for your loss.
Thank you.
I wanted to just kind of walk you through a few timeline events. You might be able to help us with these. So from the time period let me ask you first about when you first went to All Children's Hospital after you had the event on July 3rd.
Mm-hmm.
Do you remember whether you were walking or in a wheelchair then?
On July 3rd, so this is like the first time I went in for asthma?
Yeah, so it looks like you went to All Children's the first time on July 6, 2015.
Okay.
First you had your incident at home on July 3rd, and then you went to Sarasota Memorial Hospital, right? Mm-hmm. And then they took you to All Children's for the pediatric work on July 6th. Do you remember that?
Yes.
Do you remember whether you were walking or in a wheelchair?
I believe I was walking at the time.
Okay. Well, let me ask you, Clay, if you can put up Joint Exhibit 1007-26. And at the top where it says triage arrival, and it says mobility wheelchair, does this refresh your recollection as to whether you would have been in a wheelchair at that time?
I know they pushed me in a wheelchair. I had weakness of muscles, but at this point in time, it wasn't like I was confined to a wheelchair at home as well. Sorry, I misunderstood your question.
Okay. And Clay, you can take that down. Just sort of fast forwarding this a little bit. From that time, around July 6th, 2015, until October 7th, 2016, you were in a wheelchair over that period of time. Is that fair?
I was.
Okay. And just for comparison's sake, I know we'll talk later about your bravery and your perseverance to get on crutches, but you weren't even using crutches during that time period, were you?
No, but I was working my way up to that point.
So sometimes it's easier for me to sort of separate this by school year. For you, fourth grade would have been August 2015 until May 2016, age 9. Is that about right?
Yes, that's right.
Okay. And you were out of school for that year, correct?
I believe, yes, I was out in fourth grade, yes.
Okay. And then also all of fifth grade from August 2016 until May 2017, you were out of school as well. Is that right?
Yes.
Okay. Let me ask you, we got to see some photos of you. Let me ask you about, Clay, do you have access to Joint Exhibit 2530-41?
I'm sorry to interrupt. Maya informed me she's a bit hungry. I would just like to have her get this chocolate milk.
It's fine.
And Maya, would you like to take a break while you have a bite to eat?
If it doesn't bother anybody, I could just drink this here, but...
Okay. That doesn't bother me at all. But let me know if you need a break, okay? This picture is dated May 21st, 2016.
Yes.
Okay. And I think your testimony, you were feeling pretty good at that time?
Correct.
Okay.
I was getting the ketamine infusions, which lowered my pain. Therefore, I was feeling pretty good.
Okay. Clay, if you can pull up Joint Exhibit 1052-16. This, just to represent to you, this is the first note from Dr. Spiegel. He's the one who did the hyperbaric treatment with you.
Okay.
And this note was dictated 4 days earlier on May 17th, 2016. And it notes that your exam had to be cut short due to your inability to be examined. It appears there was a lot of change in your condition back and forth depending on the day. Is that fair?
Yeah, that's the nature of CRPS, and a lot of CRPS patients would report the same.
Okay. So the photo that counsel showed to the jury, you feeling good one day, 4 days earlier, you were in so much pain that the exam had to be cut short. Is that fair?
Correct.
Okay. And let me ask you about another one. And I remember that counsel showed you that by the end of July, I think it was July 28th, there was a video of you dancing to Meghan Trainor, I think.
Yes.
Okay. Let's take a look at Joint Exhibit 1028-0020. That's in evidence. That's one of the therapy notes. And at the top, it says Daily Note, July 27th, 2018. And this was the therapist that you were working with. Do you see under the current complaints, I guess my question to you, Maya, is this accurate? That the day before you had reported constant whole body pain, greatest in upper extremity and lower extremity?
Is this note the day before of the video?
Yes, the day before.
Yeah, that's accurate. When I went to Dr. Hannah's, normally I had an infusion and therapy, and the infusions did help a lot, my pain.
So, and just so I understand your answer, the day before you were reporting constant pain, whole body pain, greatest in upper extremities and lower extremities, a combination of burning, aching, intermittent stabbing pain. generally exacerbated with movement activities, but the next day you were able to perform the activities that we saw in the video.
Well, again, when I was administered those ketamine infusions, I did feel better after and was able to perform different movements that I wouldn't be able to without the medication.
Okay. So I think that you saw Do you know if you had ketamine infusions between July 27th and July 28th?
I'm not exactly certain on what days, but again, CRPS is very different on different days, and it's very hard to believe, and I understand that, but that's just how CRPS is.
Okay. So the jury heard a couple times, and you've been brave enough to share with us the discussion about the relapse after you were told that you had to go back to school sometime in August. Do you remember that?
Yes.
Okay. In the weeks leading up to going to All Children's, you would agree with me that you were in some of the worst pain of your life. Is that fair?
I was in a lot of pain, but it wasn't comparable to what the pain I was experiencing prior to the prolonged ketamine sedation in Mexico. So yes, I had relapses, and yes, they were very intense and scary still, but it wasn't as bad as how it was before the Mexico trip.
So is your recollection that in the week or so leading up to All Children's and the end of September, early October, that your pain was getting better?
No, I still had pain. I did have the relapse, but that doesn't mean ketamine doesn't work. It's just the disease itself.
Let me show you Joint Exhibit 1040-249. This is from September 29th, 2016, and if you can expand this a little bit, Clay, down on the handwriting. I guess my first question to you, Maya, is that your handwriting or is that your mom's?
That's not my handwriting.
Okay. Do you know if that's your mother's handwriting?
It looks like my mom's.
Okay. If you remember, is what your mother wrote here accurate, meaning another bad night, difficulty sleeping due to pain, 8 out of 10?
Yeah, that would correspond with my relapse at the end of September.
And that you had anxiety and depression, crying and demanding ketamine. Is that accurate with what you remember?
I wanted ketamine because that's what had worked for me in the past. It wasn't like, oh, I need ketamine, right this instant, give it to me. It's more so, I know that works, so I would like to have it.
Okay. At the end of the note it says ketamine was given every 3 hours. Do you know, does that refer to your mom giving you ketamine at home?
My mom did not give me ketamine at home. It was only oral ketamine that was administered at home.
Oh, sorry, I didn't mean to imply that. The ketamine here, your mom would have given you oral ketamine at home, right?
I don't remember if she did or not, but looking at the note.
Okay. Let me ask you about Joint Exhibit 1040-233. And I think the jury's seen this before, but is this an accurate reflection of what the condition you were in before you went to All Children's? Quality of life, non-functional?
With the relapse, yes. I was staying in bed a lot, and I did feel hopeless because I was getting a lot better, had the relapse, and I really thought I would be able to walk soon, and the relapse happened.
I'm sure it was frustrating. Let me ask you about 1040-234. And again, this is from a little less than 48 hours before you came to All Children's on October 7th. Is this your writing where it says no sleep, pain 24/7, hell on earth?
No, that's not my handwriting.
Okay. The check boxes, are those filled in by you or your mom? Do you know?
I think my mom probably would have filled it out, but she asked me.
Okay. So this would be accurate information based on what you had given your mother on October 5th, fair?
Correct.
Okay. So let me ask you a little bit about some of your time at All Children's, and I'm sure it was tough at times, but let me ask you about some things that you wrote in your journal, which is Trial Exhibit 2364, 005. You had a nurse named Amanda. You wrote a heart behind your name. Do you remember what it was that you liked about Amanda?
Yeah, I put a heart in front of her name. Amanda was pretty sweet to me. I'm not saying that all of the people at Johns Hopkins are bad, because there are certainly some people who had kind hearts, and Amanda was one of them.
Okay. There was an Amanda Cook who was your nurse from October 18th through December 26th. Is that the one that you think you're referring to?
If I'm being honest, a lot of the nurses, they had the same name, so I don't want to say yes just because I'm not for certain.
Okay. Let me ask you about a couple others. It's a Trial Exhibit 2364-008, and this is also from your care journal. People you really liked at the hospital. It was a while ago, so let me see if I can help. Do you remember Kaylee, the first one, being Kaylee Gay, a patient care technician?
No, so I have to explain this one a little bit. So in my hospital room, there's a big whiteboard in front of me, and there were names of people who were taking care of me. I just filled out the journal and I put their names in there, and part of the reason that I listed a lot of people was because I thought if they knew I liked them, they would let me go home.
Well, you listed somebody named Barb. That was Barb Flatten. She was your nurse in November. Do you remember what you liked about her?
It's hard to remember. Some of them, they weren't as regular as the other nurses. Like, I remember Amanda and I remember Lindsay, but the rest of them I'm not very familiar with.
Okay. There was one, you put Victoria Pagano. Well, I'll tell you her last name was Pagano. Victoria. She was your respiratory therapist in December. Anything particularly you remember that you liked about her?
I'm sorry, I do not remember.
How about Lindsay? She was Lindsay Arenas. She was your bedside nurse in December and January. Do you remember what it was you liked about her?
Yeah, I remember I told her about my mom's passing, and she was very compassionate, and I liked her because she was funny and she was nice to me.
Okay. On the next page, Clay, which is Trial Exhibit 2364-009. This continued with the list of people you liked. There's someone named Debbie. I'll let you know there's a nurse named Debbie Bill. She was in the pediatric ICU October 10th, 11th, and 12th. Do you remember what it was that you liked about her?
This would have been a different Debbie then because I did not list anyone from the PICU.
Okay. Do you remember who this Debbie was?
I'm sorry, I do not. The nurses, when they wrote their names on the board, it was usually just their first name and then their last initial.
Okay. The Billy, that was Billy, if you remember, was that Billy Cecil, your physical therapist?
I believe so, yes.
Okay. Billy Cecil gave you 19 physical therapy sessions between October 9th, 2016 and January 4th, 2017. Do you remember what it was you liked about him?
I remember like little snippets of our therapy sessions. Again, most of these people I just listed names because I was trying to get out of the hospital, and I'm 10, so I'm thinking if they think I like you, then I'll get out.
Beneath that is Alicia, and we talked about she was the one that was with Kathy Beatty when the photos were taken, right?
Yes.
And then below that is someone named Nicole. She was another nurse in the pediatric ICU. Do you think that was her, or do you think it might have been
was a
someone
different one for certain, but I'm not sure. I don't remember Nicole, but I don't remember listing anyone from the PICU.
Okay. There's a Sylvia. Do you remember who that Sylvia was?
I do. I had her on a few occasions. We didn't really talk much, but she was friendly.
Okay. Do you remember, she was your nurse for about 14 shifts from October through December 27th. Does that seem right?
That seems about right.
Okay. And I think you told us about a nurse named Sam that you also liked?
Yes.
Okay. There was, let me ask you about trial exhibit 2364-11. You were asked about the things you liked while you were at All Children's, and you listed good nurses. We talked about, I think, 11 of them, but you mentioned good doctors. Do you remember which doctors you liked?
Again, I just listed that in hopes of getting out. You have to remember the hospital is the one who gave me this My Care journal. It wasn't something I had brought from home. And I was under the impression that they were going to be reading it after I completed it. So I thought if I made them out to seem good, then they would consider releasing me back to my family.
You listed RJ's Activity Center. Do you remember what you liked about going to RJ's?
Yeah, that's where I met the girl Natalie.
What types of activities did you do in RJ's?
There were arts and crafts activities, and then at one point there were these, I call them the bead ladies, because they would physically come up to the room and help you make bracelets. I actually made some for my mom.
During your hospitalization, you did receive sacramental rites, correct?
At a certain point, yes.
Okay. You received sacramental rites from not just your outside from your father at your church, but you also received them from Father Coover at All Children's. Do you remember that?
Would that be Tom is his first name, right?
Yeah.
Okay, that's how I knew him, Father Tom, yeah.
Gotcha. Okay. I used his last name. I apologize.
It's all good. I just want to make sure.
Yeah, okay. Father Tom also administered on more than one occasion sacramental rites while you were at All Children's, right?
Yes, I think it was like once or twice.
Okay.
But I just wanted to say the first time he came, he did not give me the sacrament, actually. It took, I think, about like a month until I was actually able to receive the body of Christ. And then he told me some things about his past, so I didn't end up seeing him again.
Okay. The records I have show that you received sacramental rites at least twice from Father Tom. Does that seem accurate too?
Well, the first time he didn't show up with it. It was only the second time. So I did see him on 2 occasions, but it was only one occasion that I actually received the sacrament.
If we could go to Joint Exhibit 1001-1834. And at the bottom, the comments section. At least according to this, it said that Father Tom had visited you on both Saturday and Sunday and provided the sacramental rites on at least 2 of those occasions. Does that help refresh the time period for you?
Honestly, I am certain that it took at least a couple of weeks before I received the body. I know that for certain. I know that I visited with him, and again, the first time he didn't have it, but it did take some time.
During your hospitalization, you had the chance to nominate a nurse for a Daisy Award. Is that right?
Yes.
Okay. And what's a Daisy Award?
I think it's just like an award that you give to a nice nurse. You write somebody's name down.
Okay. Let me show you exhibit. Actually, this is not in evidence yet. So if I could hand it to the witness. May I approach?
You may approach.
Thank you, Your Honor.
But show it to Mr. Anderson first.
On the second page of the exhibit, Maya, maybe you could help me with your handwriting and tell me what you wrote about your nomination. Well, first, who did you nominate for a Daisy Award?
It was that Lindsay I said earlier that was nice.
And what were your reasons for nominating Nurse Lindsay for a Daisy Award?
I could take the word nice, I see. Sorry, it's going to take me a minute to read this handwriting. I know it's my own, but it's very messy.
Sure, take your time.
Okay, I said fast and super nice. The reason I mentioned fast was that in the PICU, if you remember, Ashley Sumner, she would always yell at me to wait to use the restroom. So when nurses actually took the time to answer my call and take me to the restroom, was very appreciative of that. And then she was nice. She didn't yell at me. And actually, the example I used here was I used the bathroom or anything. She will come as fast as possible. It's actually quite sad that that's what I appreciated, because I feel like that should be standard for every patient, even in the PICU.
Let me ask you a little bit about the photographs. Are you aware that the photographs that we showed, the ones that were taken before you could go to court, you remember those?
Yes.
You are aware that there was a second set of photographs taken after you returned from court to document the differences?
The truth is, I feel like I would have remembered that, and I don't have any recollection of a second set of photos being taken of me.
So at least as you sit here today, you don't remember whether two sets of photos were taken, but it's entirely possible there were two sets. Is that fair?
I really don't think there is two sets. There was only one set taken, Kathy and Alicia. I remember a group of doctors coming into my room and asking if I would be ready for the second set, and I told them no, I don't want to, and they didn't do it.
Okay. And I guess the reason I ask is the photos that the jury were shown, do you know whether those were all taken at one time or whether they in fact reflect photos taken before court and photos taken after?
To my recollection, it was that one set. I was changing from my pajamas to a court outfit.
And I guess you wore a dress to court, if you remember.
I think my uncle may have brought a dress or something, yes.
Okay. So let me transition a little bit with you after you got out of All Children's, okay? And we all had the chance to meet Rachel DeYoung, your therapist?
Yes.
Okay. It sounds like from a time frame, and you would be finishing sixth grade, although doing it virtually, from January 2017, when you were out of All Children's, until August 2017, what you did to make your recovery was physical therapy, and that was it? Fair?
No, I did the warm water therapy as well, and I believe I was seeking counseling at the time to help with coping with my mom's passing as well as my disease.
So from that period of time, January through August of 2017, physical therapy, warm water therapy, and cognitive therapy with grief counseling. Is that fair?
Yes.
And that plus your courage to work through the pain was able to get you to a point that from the time of your discharge from All Children's in January, that by the time school started in August, which would now be going into sixth grade, that you were able to get out of the wheelchair and be on crutches. Is that right?
I was on crutches, yes.
Okay. From that time that you shed your wheelchair, you haven't had to use it again for ambulation. Is that fair?
No, but again, I still have pain. There's days where I literally stay in bed all day, and it's not just a single day. I'm talking days on end.
So seventh grade comes around, and that would be August 2018 through May 2019, okay? Mm-hmm. You were off crutches by that summer, correct?
Correct.
And then, if I recall, what you told me was you actually went back into seventh grade and picked phys ed as an elective.
Yes. So sixth grade, it was required that I take it, which was weird because I was on crutches, but I just did physical therapy exercises up on the stage. And then seventh grade, I did start PE because, you're walking. It's like the first time you've ever walked in such a long time. Obviously, the first thing you want to do is play.
So if I understand what you're telling the jury, by eighth grade, you were participating in phys ed with no restrictions, correct?
Not with no restrictions. There were tests that we had to do, physical tests that I think the county is just required to do. One of the tests is running a mile, which seems really it doesn't seem very difficult, but I was unable to do it because of an asthma flare-up. And as well as I didn't have the physical ability at that time, even though I was able to walk, it doesn't mean I could run for long distances, like a mile.
By 8th grade, you were fully participating in all sports, true?
Well, not all the sports. I was like figure skating or gymnastics or ballet, but in I don't think I took PE in 8th grade. I think it was just 7th.
In the 8th grade, you were president of the choir?
I'm sorry, what was that?
President of the choir.
Yes.
And you were president of Students Against Drunk Driving?
Students working against tobacco.
Okay. I gotcha. SWAT. You were National Junior Honor Society?
Yes, I was the president of that.
You were back scuba diving?
I believe so, yes. I got my scuba certification.
Okay. And you don't recall having any CRPS flare-ups in the 6th, 7th, or 8th grade, correct?
Nothing to a point where I wasn't able to walk or anything, but it's not fair to say that I didn't have pain, because I definitely did, and my dad heard a lot of that.
Okay. Yeah, and the reason I ask is because when we had a chance to talk, and I had asked you whether you had any flare-ups in 6th, 7th, or 8th grade, you had told me no. Is that true?
Right, that's what I'm saying. It's not a flare-up to the point where I couldn't do anything, but I did still have pain.
And and this was, the time period of 8th grade would have been August 2017 August 2017 to May 2018, and then August 2018 to May 2019 would be 7th grade, and then August 2019 to May 2020 would be 8th grade, right?
Yes.
And then just to get a sense of your workout routine, the recovery that you were able to make, by August 28th, 2020, you had talked to me a little bit about your workout routine. Do I recall correctly that you were getting up around 4:30 in the morning for your workouts?
Yeah, so at the time, I still struggled with sleep and everything, so I woke up early anyway. It's just like an internal alarm clock. So I thought I would use that time, because I was in school, I would use that time to work out, and then I would go to bed as early as I can following school. But I was really dedicated to keeping my strength and maintaining my muscle tone.
Mm-hmm. And it looks like by then, through your dedication to this and the recovery, you were able to do about 5.5 miles every morning.
I did about 5 laps, but I don't think the entire circle is a mile. It's a little bit less. I don't know the exact.
May have been closer to 4 miles every morning.
Yeah.
And you were also able to do high intensity interval training as well.
Right, but not for prolonged periods of time. Again, it was just, challenging myself.
And then unfortunately in August 2020, it looks like you broke your finger playing sports.
I did. I caught a football in a weird way.
Okay. It's happened to all of us. So you had surgery to repair your broken finger, is that right?
I got a pin placed.
Okay. And fortunately, that did not cause any CRPS flares or relapse, correct?
Correct. So not every injury is going to bring on a CRPS relapse. It's just not the nature of it. Some people are more sensitive, but for me, there's been times I've been injured, and there's been times I've endured stress and haven't had a relapse, and that's normal too.
And so, again, on the calendar, from the period of time from when you came out of All Children's in January of 2017 until this time when you talked about the broken finger in August 2020, the only medications that you were taking were Flonase and Claritin. Is that fair?
Well, I was discharged with about 14 at All Children's Hospital, so I took those until they weren't prescribed anymore. And then slowly I was weaned off of pretty much everything. And it's like different medications. I have one for sleep that I didn't mention, and that's my bad.
Okay, so for the period after you finished the medications that you were discharged with from All Children's, that period of time, 2017, 2018, 2019, 2020, the medications that you were taking would have been for allergies and to help sleep. Is that fair?
Yes.
You talked about returning to figure skating. You mentioned doing a jump called a salchow. What's that?
It's a special kind of jump. I really can't explain it in terms that would like make sense, but I was working on it. Yeah, this was in high school.
Okay. Is it like where you drop your skate into the ice and flip in the air, or?
You do pick your toe into the ice, and then you do a little twirl in the air.
Okay. You won a skating competition?
I was against like 5-year-olds, if I'm being completely honest. It's so embarrassing, but my skill level was not of that it used to be.
Well, you got to take credit for it. You won a competition. Okay. Fast forwarding to high school, by 2022, you were a sophomore in high school, right?
Yes.
Okay. And you're still doing physically better in 2022 than you were before you went into all children's. Is that fair?
Yes, I didn't have an active relapse at the time.
Okay. And then 2023, you would have finished at the end of the summer, your junior year in high school. Is that right?
Correct.
Okay. And that's when you got a job at Cracker Barrel?
I did, yes.
And then it looks like, you in general, you're going to the gym about 5 days a week?
I tried my best, but most of it was just walking on the treadmill. And then when I started working, I didn't go to the gym as much.
And then in terms of medications, again, in your junior year, it looks like you were taking Claritin, Flonase, a sleep aid, and seeing a doctor for eczema. Is that fair?
Yes.
Okay. Let me ask you about some photos, and I'm just going to approach it. These are not in evidence yet, but I was just going to ask about some authentication.
Show them Mr. Anderson first, please.
Yes. Maya, at the bottom of the photos, there's those things you've probably gotten used to. They're like exhibit numbers. You see? Okay.
Yeah.
The first one is exhibit 001. Do you know when that photo was taken?
I don't know the exact date, but it was fairly recent.
Do you know if that was part of the People magazine photo shoot?
It was.
Okay. What about photo 002?
Yes.
Was that also part of the People magazine photo shoot?
Yes.
And what about 003? Do you know when that was taken?
It was also part of that.
What about 007? Just skipping ahead a couple.
Yep. That's not part of that shoot. This was taken at a different time.
Okay. Do you know approximately when that photo was taken?
I have the date in my phone, but I don't want to make any assumptions.
Okay. What about 008?
That was part of the People magazine.
Okay. What about 009?
That was in New York at the Tribeca Film Festival. I don't know the exact date again. I don't want to make a mistake.
Okay. May I retrieve the documents, Your Honor?
You may.
Yeah.
Have you seen Dr. Barr as a patient since you were discharged from All Children's?
I don't remember.
Okay. How about Dr. Spiegel? Have you seen him since you've left All Children's? And just, I'm sure it's hard to remember everything. He was the one who did the hyperbaric oxygen treatments.
No, I haven't. Again, I'm very afraid of going to doctors, and unfortunately, I think it's a fear I'm going to be living with.
Okay.
I said, unfortunately, I think it's going to be a fear I'll be living with.